Welcome all. So hope everyone is happy. Okay. So last section we were discussing about the pulp vitality test, and in that we were focusing on the heat test. So today we are going to discuss on the cold test. So cold test, it is a neural sensibility test in which the status of the pulp is evaluated by stimulating the nerve fibers within the pulp. So commonly used materials to perform cold test are ice stick, which is temperature 0 degrees Celsius, endo ice, that is minus 26 degrees Celsius, then carbon dioxide snow, that is minus 78 degree Celsius, and ethyl chloride, which has got a temperature of minus 5 degrees Celsius. So what are the materials that is used to perform cold test? What is endo ice, that is 1112 tetrafluoroethane, carbon dioxide snow, ethyl chloride, pencil of ice, cold water bath and a rubber dam isolation. Among this, the most commonly used is the endo ice. For that, a cotton pellet is saturated with endo ice and then it is applied on the facial surface of the tooth. You can also perform cold test by wrapping a silver of ice with a gauze and placing on the facial surface of the tooth. You can also make a pencil of ice by filling water in the discarded anesthetic capsule and freezing them in the refrigerator in upright position. So here is the image of how and cold test is performed using endo ice. For that, an endo ice is saturated with cotton pellet and applied on the facial surface of the tooth. So another method to assess the cold test is the dry ice or the carbon dioxide snow. This is described by Erman. For this, the temperature used is a minus 78 degrees Celsius. To perform cold test, to perform thermal test in the full coverage restoration, this carbon dioxide snow or the dry ice is a better option. So now coming to the mechanism of action of the cold test, which is explained by the Bamstrom theory. That is, when the cold is applied, there will be contraction or the outward movement of the fluid in the dentinal tubules, which causes increase in the intrapulpal pressure. And as a result of this, the following responses are seen. The cold application is done for less than 15 seconds, following which we will get some response. So the response can be either a pain which lasts for only few seconds, then it might be a reversible pulpitis, or it might be a immediate pain or a lingering pain, that might be irreversible pulpitis, or the patient shows gives a positive response compared to the contralateral tooth, then it is a healthy pulp, or the response might be no response, then the tooth might be non-vital. But make sure that you should perform other tests to confirm your diagnosis. Hope everyone got a brief idea about cold test. On the next section, we will deal with the rest of the pulp vitality test. So until then, take care.